Welcome, everyone, to this session by Dr. Helena Moura on climate change and its impact on mental health. What we have seen in the last decade or so, not only that people have become much more aware of climate change, but the impact climate change is having on people's mental health. It is very clear from the research that uncertainty related to climate change influences people's mental health. People tend to migrate. Most of these changes are related to man-made disasters. Some are natural disasters such as earthquakes, tsunamis, hurricane, etc. But it again leads to an inordinate amount of migration where people tend to migrate either within the country or seek refuge elsewhere. Climate change is one of the biggest challenges in human history, and we need to take into account its impact not only on physical health, but people's mental health and well being. Thank you.
Hi, this is Helena, and in this module of the Geopsychiatry course, we aim to summarize current evidence and propose strategies to tackle geopolitical challenges on mental health, focusing on the two significant areas of climate change and migration. Climate change can affect mental health directly or indirectly in a variety of ways, including chronic, such as global warming, and acute events such as heat waves and environmental disasters. Their impacts are unequally distributed, with certain groups disproportionately affected because of the many compounding geopolitical factors. And here are some of the climate change events that we studied when we are trying to understand its effect on mental health. Severe weather events, global warming, ecological anxiety, and solastalgia. Severe weather events are known to increase rates of depression, anxiety disorder, PTSD, and suicide. Within the spectrum of climate-related mental health consequences, specific attention has been directed towards the vulnerability of two distinct demographics, the younger generation and the elderly. Moreover, gender differences emerge, with women facing a higher likelihood of experiencing depression, anxiety, and stress-related disorders, while men are more prone to suicide mortality. Lifestyle and socioeconomic factors associated with mental health can also be threatened by extreme weather conditions. Difficulty in accessing healthy food, or in more serious cases, food insecurity, have been reported as some of the consequences of climate-related impacts on agriculture. Furthermore, livelihood shortages force many to leave their land and migrate elsewhere. About global warming, we know that 1 degree rise in ambient temperature, mental health mortality, including organic mental disorders, suicide, and self-harm, increased by 2.2%. Similarly, mental health morbidity, particularly affecting mood and anxiety disorders, as well as schizophrenia, showed a 0.9% increase. These impacts were more pronounced among individuals aged 16 years or more, as well as among men. People who are exposed to temperatures of 32 degrees Celsius or higher show decreased levels of positive feelings and increased irritability and fatigue. Women and people with low socioeconomic status are more vulnerable to these outcomes, and probably because the poorest people have less resources to adapt to increased temperatures. Eco-anxiety. Eco-anxiety or grief encompasses the feelings of stress and apprehension stemming from the anticipation of future environmental changes or the sense of loss associated with ongoing ecological degradation. Children, adolescents, and individuals whose livelihoods are closely intertwined with the land experience are more vulnerable. Moreover, individuals with limited access to mental health care often struggle with more acute forms of eco-anxiety or grief, exacerbating the challenges they face in navigating these psychological distresses. And finally, solastalgia encompasses a profound distress that arises when one realizes that the cherished location they call home is undergoing physical desolation. This phenomenon becomes evident through a profound assault on one's sense of place, eroding the feeling of belonging and identity associated with that specific environment, leading to a deep sense of distress brought about by its profound transformation. Populations which cultural roots have a greater connection with the environment, such as indigenous people, are particularly more vulnerable to this phenomenon. The mental health consequences of climate change are still poorly understood. Nevertheless, it is evident that countries in the global south bear the heaviest burden of its impact, struggling with heightened environmental challenges while having limited coping resources at their disposal. Despite this, the majority of studies examining mental health impacts of such events originate from high-income countries, and there's a notable lack of comprehensive preventive and treatment strategies in place. And here are some suggestions to address the climate change challenges. Proper governance can help adaptation of climate change actions, which in turn can mitigate several mental health-related issues. The World Health Organization policy document of climate change clearly recommends the role of governance. And in this sense, it is essential to integrate climate change considerations into policies and programs for mental health. Because climate change events are increasing in frequency and severity, better preparedness and disaster risk reduction are essential and should be seen as a way to protect not only people's life, but people's mental health as well. Risk monitoring and a watch for early warning signs are critical in prevention or implementation of early interventions that should be seen in parallel with assessment of vulnerability. In some cases, geographical reallocation can be essential, as in the case of severe climatic events or when agriculture has lost its productivity. Therefore, facilitating conditions for community mobilization is important. And here's an important message. The burden of mental illness must be taken into account when assessing the cost-benefit of public policies aimed at protecting the environment. And in this context, psychiatrists have an important role as advocates. Training of the workforce, including psychologists, social workers, occupational therapists, nurses, and doctors, needs to include climate change-related action. Training must incorporate the need for emergency preparedness. As we've seen in this presentation, increased temperatures are associated with decreased well-being and increased irritability. Extreme cold wave can be associated with reduced exposure to sunlight, and this can also affect mood. Therefore, health services should expect an increase in demand for mental health care in these circumstances and should be prepared for it. Interventions themselves must pay close attention to climatic conditions and consequent medical comorbidities. Vocational rehabilitation programs for chronic mentally ill, such as cottage industry-based vocational skills training, are viewed as easy to deliver and market. However, these programs need to be informed about factors such as pollution, toxicity, and extreme heat and how it can affect mental health. Regarding research, there is a need to include the climatic change considerations in mental health research, and also to include mental health considerations in climate change and health proposals. More research is needed, especially in low and income countries, as these are the countries that bear the heaviest burden of climate change. And now we're going to explore the theme of migration. Migration refers to the process of moving geographically from their usual location to another, either within a country, such as between rural and urban areas, or across an international border. Refugees represent a distinct population who face extreme peril in their home countries, making it too dangerous for them to consider returning home due to armed conflicts or persecution. There are many reasons for migration, including better opportunities for education, work, and general living conditions, which we call the pull factors. However, some people are forced to move because of economic hardship, conflicting political positions, climate change, and situational unrest. And this we call the push factors. As a result, many migrants inevitably use irregular migration processes and may expose to human trafficking, illegal occupation, sexual and physical violence, and life-threatening situations. When we study the migration process, we talk about what happens before departure, during departure, and after departure. So before departure, many migrants may witness or have direct traumatic experiences involving poor living conditions and situational unrest in their homeland. They may also feel frustrated by lengthy and complicated application process for migration. During travel, many people may be abused financially and physically. After arrival, many migrants would later realize that they need to either partially or totally lose their original culture and accept a new one, called the process of acculturation, which can be hindered due to discrimination based on, for example, race, religious beliefs, and gender. Migrants with insufficient language proficiency may find it challenging to communicate with other people on daily matters and when a crisis occurs. It is not uncommon that migrants are underprotected by occupational safety and social care benefits and unable to access standard educational programs and healthcare services. These stressors lead to increased risk of psychiatric disorders among migrants, including schizophrenia and psychotic disorders, depression, substance use disorders, and self-harm and suicidal attempts. Many psychiatric conditions are associated with migration. In a large cohort Swedish study, the risk of non-affective psychosis among migrants increased almost 3 times compared to the Swedish-born population. Similarly, another recent meta-analysis reported increased rates of non-affective psychosis in both first and second generation migrants. Many migrants struggle with achieving new cultural and social expectations, resulting in low self-esteem, and this could make depression common in migrants with the aggregate prevalence identified from a meta-analysis to be of 15.6%. Post-traumatic stress disorder in migrants is sometimes overdiagnosed, as reported in previous studies, with a high prevalence of 47%. Otherwise, PTSD-like symptoms can be normal reactions in people from some cultures. Although substance use disorders are not uncommon among migrants, they can be poorly recognized and managed due to different concepts towards certain substances and addictive behaviors in migrants' original and new cultures. A recent systematic review reported that compared to the non-migrant counterpart, young migrants had higher rates of self-harm and suicidal attempts, but no major difference in suicidal ideation and suicidal death. Certain groups of migrants are particularly vulnerable to developing psychiatric disorders and need special attention to receive screening programs and appropriate treatment. During detention, migrant children may be traumatized from being separated from their parents. Their education may be unnecessarily interrupted or even discontinued. Older migrants may have trouble establishing new relationships with people from different cultures, putting them at risk of developing physical infirmity and mental health problems. Diagnosis of dementia in older migrants can be problematic due to language barriers and cultural influences on the applicability of cognitive assessment. Women migrants can be confused about their conflicting gender roles and expectations between their homeland and host cultures. As social norms undergo transformation, there is an observable increase in the migration of women who enter the workforce, leading to shifts in family structures and support systems. Certain women may be subjected to coerced sex trafficking and may not receive sufficient support and protection from the host country or region. Refugees and asylum seekers may be frustrated by the protracted asylum procedures and feel anxious and guilty about leaving their families behind. And here are some suggestions for action to deal with this crisis. Immigrants should have easy access to mental health care. The burden of mental illness must be taken into account when developing public policies to deal with the migration crisis. These actions are only considering local interventions. At the global level, as we discussed in our first class, the actions are more complex and involve everything from resolving local conflicts to mitigating and controlling climate change. Clinicians must have an accurate understanding of migrant patients' cultural backgrounds, and this requires training in cross-cultural psychiatry. In addition, mental health services should have translators to help with communication. About research, there are some research ethics committee challenges. Those who have coordinated an international multi-center study know how challenging it can be to adapt the research protocol to different countries. Questions such as what color or what race are you can be culturally acceptable in some countries or considered a manifestation of racism in others. In the case of multi-center studies, these questions are assessed by the committee in each country. However, the committees may not be prepared to assess the cultural aspects of an immigrant population, and this can jeopardize their participation in research. In addition, ethnic minority groups are often difficult to recruit. Yet, to improve policies and interventions related to mental health in migrants, we need more research on such issues, both in quantitative and qualitative approaches. Qualitative studies can be an important starting point when assessing a culturally diverse population and can help formulate quantitative assessment tools, especially when there are no validated scales to assess psychiatric symptoms in that population yet. The existing literature is predominantly from Western studies and egocentric societies. Future research should be extended to the perspectives of the Eastern and socio-centric cultures. Unfortunately, both people with mental disorders and immigrants carry a heavy burden of stigma. When working in the field of advocacy or research, it is important to be careful when reporting on the recurrence of mental disorders in immigrant population as not to reinforce stigma. And since we're talking about advocacy, maybe we should talk about advocacy training too. We know that dialoguing with politicians can be difficult, and many health professionals and researchers don't feel comfortable with it. But just as we already do media training to communicate better with the press, perhaps we should include advocacy training in our curricula as well. And continuing on the topic of research, here are some examples of how the geopsychiatry approach can be used in research, including to exploit existing data. In this study, authors assessed differences in brain structure between healthy adult men and women from samples obtained in 29 countries where these data were entered into a random effects meta-analysis, including a meta-regression, in which country-level gender inequality acted as an exploratory variable for the observed differences. Their hypothesis was that unequal exposure to harsher conditions for women compared to men in gender unequal countries might be reflected in differences in their brain structure. This hypothesis was confirmed as authors have found that women from countries with greater gender inequality have thinner cortices than men. And here are the countries that were included in this study. In this figure, we can see the countries from which they extracted data and the level of gender inequality. The diamonds describe gender inequality Z-score, and higher values denote higher inequality. Despite including various geographical regions, the majority of studies came from high-income countries. This is another study, and in this study, authors compared different mental health outcomes after the 2008 economic crisis and concluded that countries that reduced their investment in health and social care had increased rates of suicide and other unfavorable mental health outcomes when compared to countries that maintained these investments. All countries included in this analysis were high-income countries, and again, this highlights the importance of performing studies in low and middle-income countries. In conclusion, climate change and migration are currently noteworthy geopolitical challenges for mental health. The burden of mental illness must be taken into account when assessing cost-benefit of public policies aimed at responding to the climate change and migration crisis. It is important to have special training for the workforce so they can be prepared to deal with this population. And psychiatrists have an important role as advocates when it comes to developing new public policies. In research, geographic and geopolitical factors should be used as an explanatory variable for mental health outcomes. And in our next and last class, we are going to talk about the CAPE Vulnerability Index and how it can help countries to raise funding.